Every year, thousands of nursing students walk into the NCLEX, see a heart failure question, and freeze on the same thing: is this left-sided or right-sided? They mix up the symptoms, pick the wrong answer, and lose points they should have had. Here's the truth: heart failure isn't hard. It only feels hard because nobody showed it to you the right way. By the end of this video, you'll never confuse left and right again, because you'll actually see what's happening inside the body. One simple idea fixes all of it: when a side of the heart fails, blood backs up behind it. That's the whole secret. Stick with me, and watch this click into place. If this is the kind of clear, visual learning you've been missing, subscribe. That's what this whole channel is built for. Let's start with the rule, because once you have it, everything else falls out for free. The heart is really two pumps working side by side. The right side receives blood coming back from the body and sends it to the lungs to pick up oxygen. The left side receives that oxygen-rich blood from the lungs and pushes it out to the entire body. Forward, 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 that's a healthy heart. Now, heart failure means a side of the heart can't pump forward effectively. And when a pump can't move blood forward, that blood doesn't just disappear. It backs up, behind the side that failed. That is the single most important sentence in this entire topic. Blood backs up behind the failing side. Remember that, and you can reason out every symptom instead of memorizing them. Let's do the left side first. The left side of the heart receives blood from the lungs. So ask yourself, if the left side fails and can't push blood forward to the body, where does that blood back up? Backward. Into the lungs. This is the key: left equals lungs. Say it with me: left, lungs. They even start with the same sound. That's your anchor. When blood backs up into the lungs, pressure rises in the lungs' blood vessels, and fluid gets pushed out into the air sacs. The lungs are now partly filled with fluid where air should be. This is pulmonary edema, and it drives every left-sided symptom you need to know. So what does the patient look like? They're short of breath, because their lungs are wet. They have a cough, sometimes with frothy or pink-tinged sputum. That's fluid in the lungs. You'll hear crackles when you listen to the lungs. They get short of breath lying flat, so they prop themselves up on pillows to breathe. That's orthopnea. And they may wake up at night gasping for air. Notice the pattern: every single one of these is a lung symptom. You didn't memorize them, you reasoned them out from left equals lungs. Now the right side. The right side of the heart receives blood coming back from the body. So if the right side fails and can't push blood forward to the lungs, where does the blood back up this time? Back into the body. Here's your second anchor: right equals rest of the body. Left was lungs, right is the rest of the body. Everything is systemic. When blood backs up into the body, fluid leaks out into the tissues, and gravity pulls it downward. So you get swelling in the feet, ankles, and legs, peripheral edema. You get a backed up neck vein you can actually see, jugular venous distension. Fluid pools in the abdomen, ascites. The liver and spleen get congested and enlarge. Weight goes up from all the retained fluid. Again, every one of these is a body symptom, not a lung symptom. Right equals rest of the body. And here's the contrast that locks it in. Left-sided failure floods the lungs, breathing problems. Right-sided failure floods the body, swelling problems. One picture, two sides, two completely different patient presentations. One more thing the exam loves to test. What's the most common cause of right-sided heart failure? Left-sided heart failure. Think about it: if the left side is failing and backing up into the lungs, that rising lung pressure eventually strains the right side until it fails too. That's why many patients end up with both. When the whole heart is struggling, it's called congestive heart failure. Let's lock in the NCLEX cues. If the question describes shortness of breath, crackles, orthopnea, frothy or pink sputum, think left, think lungs. If the question describes edema, weight gain, jugular venous distension, ascites, enlarged liver, think right, think rest of the body. The exam writes questions by describing symptoms and asking you to identify the type. Now you don't guess, you trace the backup. Left, lungs. Right, rest of the body. So here's everything in one breath. The heart is 2 pumps. When a side fails, blood backs up behind it. Left side backs up into the lungs, breathing symptoms. Right side backs up into the body, swelling symptoms. And left-sided failure is the most common cause of right-sided failure. That's heart failure. Not memorized, understood. If this made it click, you already know what to do, like it so it reaches another student who's stuck, and subscribe so you don't miss the next one. We're building this whole channel one clear concept at a time. See it. Understand it. Remember it. I'll see you in the next one.